So this person is anxious on the night before they have to go into the office, and as a clinical psychologist has asked me if I can give any tips. So the most important thing for falling asleep is about feeling safe enough to do so. And it appears, probably in this case, that your brain is creating lots of scenarios and worries about going into the office the next day, which is making you feel unsafe. So what I would recommend is doing a brain dump before you get into bed and start to try and wind down. Get a notebook and jot down everything your brain is trying to hold on to and problem solve. Just make a big list, no matter how big or small, just get it all out of your head and onto a piece of paper. Then underline the ones that are causing you the most grief, the ones that really tend to spin around in your head a lot. This is where it's worthwhile trying to differentiate between those types of worries, and I've got a video linked underneath to watch in order to work out if it's a hypothetical, a what-if style worry, or a real event worry, because there are different strategies. The next step is then to have some sort of regular routine, which you use on the days when you are going to the office as well as days when you're not. And the thing with routine is it feels comfortable and it creates a sense of security because your brain and body know what next is coming and begins to feel safe enough to switch off. And it can look different for different people, but typical things might be having a warm shower or a bath, having some sort of warm drink, trying to read a book or something like that in bed. Obviously, there's lots of research that shows that screens can elevate our anxiety, so trying to avoid screens if you can and keeping your phone out of the room. There's also lots of research that helps. So finally, once you're actually in bed, you might find it helpful to do some sort of progressive muscle relaxation exercise. You can Google that and just do that by yourself, lying in bed. It helps the body to tense muscles and then relax, can kind of release the tension. And it also gives a focus, because if your brain wants to be pulled away to the worries that you've already brain dumped on, you can just gently guide it back to the focus of your attention on the muscles. And then that trick of redirecting your attention back to the here and now is what you're going to be doing every time it gets pulled off and wants to start ruminating on all the anxiety about going into the office again. If you've been trying to sleep for about 20 to 30 minutes and it's just not coming, don't continue to lie in bed. The research shows it's much better to get up and go and do something very gentle and dull, like reading your book in a different armchair, for example. Lying in bed just raises the tension.